Hello, I'm Dr. Frederick Eccles, Acting Director of Health for the City of St. Louis. It's influenza season. While influenza, commonly called the flu, can be detected year-round in the United States, flu viruses are most common during the fall and winter. The exact timing and duration of flu seasons can vary, but influenza activity often begins to increase in October. Usually, flu activity peaks between December and February, although significant activity can last as late as May. Flu is a contagious respiratory illness caused by influenza viruses. It can cause mild to severe illness. Serious outcomes of flu infection can result in hospitalization or death. Some people, such as older individuals, young children, and people with certain health conditions, are at high risk of serious flu complications. Child care facilities play a critical role in providing safe and secure environments for the social and educational development of young children during major parts of the day. Flu awareness and prevention practices are essential in providing that environment. During the following presentation, Shanetta Harrington, Interim Coordinator of Nursing Services for the St. Louis Public Schools, will be reviewing the signs and symptoms of flu and providing you with helpful measures to ensure in slowing the spread of flu in your facilities. Enjoy the presentation, and remember the City of St. Louis Department of Health joins the Centers for Disease Control and Prevention in recommending everyone 6 months of age and older, with limited exceptions, get an annual flu shot. Be well.
Thank you, Dr. Eccles. I'm Nurse Harrington with St. Louis Public Schools. Thank you for taking the time today to learn more about the flu and how you can continue to ensure the health of children in your care. Child care providers, we need your help to prevent the flu from spreading at your facilities. Here are some simple measures to slow the spread of flu. Clean and disinfect frequently touched surfaces and objects. Be sure this process is safely and correctly performed. Always follow label directions on cleaning products and disinfectants. Wash surfaces with a general household cleaner to remove germs. Rinse with water and follow with an EPA-registered disinfectant to kill germs. Read the label to make sure it states that EPA has approved the product for effectiveness against the influenza virus. Pay close attention to hazardous warnings and directions on product labels. Encourage staff to stay home when they are ill, and when possible, encourage staff to get the flu vaccine. Cover coughs and sneezes, and wash hands correctly and often. It's important to recognize the signs and symptoms of the flu. The symptoms of flu can include fever, or feeling feverish or chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, and tiredness. Cold symptoms are usually milder than the symptoms of flu. Colds are more likely to cause a runny or stuffy nose and generally do not result in serious health problems. On the other hand, children younger than 5 years, especially those younger than 2 years old, are at high risk of developing serious flu-related complications if they get sick. Influenza causes more hospitalizations among young children than any other vaccine-preventable disease. The single best way to protect against seasonal flu and its potential serious complications like pneumonia is for children to get a seasonal influenza vaccine each year. Flu vaccination is recommended for all children aged 6 months and older. For most children, it is good practice to get them vaccinated by the end of October. There are different types of flu vaccines available. Parents, please consult with your child's healthcare provider to determine which vaccines are right for your child. If cost is an issue, you can ask your trusted healthcare professional about whether your child is eligible for the Vaccines for Children program. This program provides funds to cover the cost of vaccinations. Parents and child care providers, We need your help in keeping our most vulnerable loved ones safe and healthy. We want our preschoolers to focus on achieving developmental milestones, not recovering from vaccine-preventable diseases like the flu. Connect with your local public health agency for more information on flu vaccines.